I'm Dr. Sheppard with Aligned Family Wellness, and today we're going to be talking about plagiocephaly. So some of the most common questions I get from parents of infants are about the flat spots or the cranial shape of their head. Does it look like they need a helmet? Do you think it'll get better on its own? We tried some tummy time, but is that enough? Is this going to stay this way? With most parents having a lot of these questions, even if they haven't asked them out loud, the topic of plagiocephaly needs to be addressed. What are the causes and how can we help before it's too late? So unfortunately for most parents, helmets tend to be the only option offered for plagiocephaly by a lot of medical doctors and specialists. However, this approach does not get to the root cause of the problem, nor does it help with the mobility challenges that come along with the plagiocephaly. So we will answer all your questions about it. What it is, what causes it, and is the helmet the only way to treat it? And what are some most natural, effective, and gentle ways to care for the child that's struggling with it? So let's talk about the three main causes of plagiocephaly. So number one is pressure from positioning while sleeping or even while in the womb. So plagiocephaly is caused by repeated pressure on one part of the baby's skull, and it's made worse when babies lay or sleep in the same position most of the time. So this is really common in infants, and studies show that about 20 to 25% of babies develop some sort of plagiocephaly when they sleep on their backs. So this was not as big of a problem when we had babies sleeping on their stomach. Then we had a lot of incidents of SIDS, and we did this whole back to sleep program where parents are encouraged to put their babies on their backs. And now we're getting lots more plagiocephaly from babies always sleeping on one side. So plagiocephaly can also start to develop when the babies are in the womb. So if they get stuck in an normal position and their head is tightly pressed against the uterus, that they can have plagiocephaly. That's flattening of the skull in the womb. The risk is higher when you have twins or multiples because there's less room in the womb for those babies to move around. So number two is a muscular torticollis. It causes a stiff, stuck, twisted neck with limiting movement. So plagiocephaly can be talked about alongside this muscular torticollis, which we already did a video on that, so go back and watch that. But that's the condition where the infant has a stiff, stuck, twisted neck and the child's head is bent to one side. So they don't want to turn or rotate their head in both directions. So it causes a lot of tension and restricted movement with the torticollis, and then that leads to plagiocephaly because the kids don't want to turn their head. So they always have their head resting on the same side. So you can have both of those conditions going on at the same time, which is what we see a lot in our office. So number three is birth interventions, which include forceps, vacuum, or C-section. So all of these birth interventions have been associated with an increased incidence of head-shaped abnormality in infants. So studies have investigated the relationship between birth intervention and the incidence of plagiocephaly. So a systematic review and meta-analysis published in the Journal of Pediatric Rehab in 2018 found that the use of forceps or vacuum during delivery was associated with significant risk of plagiocephaly. So what are some signs if you think your baby may be struggling? So symptoms of plagiocephaly are pretty straightforward. You can see that flat spot on the side of their head, or their whole back of their head is pretty flat. They rub a spot and they have less hair on that flat side. If you look down at the baby's head, the ear may be kind of pushed forward on that side. And if you're looking at the face, there could be some imbalance in their facial features. So really, really severe cases, they may have some forehead bulging on the opposite side because as it's pushing, then it's going to push if it's flattening, it's pushing the other side, causing asymmetry. So plagiocephaly shouldn't be painful. The risk is that they will struggle to hit their developmental milestones. So they just can't do all their gross motor functions because of the torticollis and the difficulty, turning their head. And studies show that these delays could carry on into the toddler years. We have a PubMed link that I will link in the comments, so you can read that article if you would like. So kids with unresolved plagiocephaly could be susceptible to ear infections and respiratory infections since the subluxations and motion restricted. They limit the body's ability to drain the fluid from the ears and move the mucus through the respiratory and lymphatic systems. Which we see a lot in kiddos that have had torticollis unresolved. They have a bunch of ear infections. So what are some natural and less invasive options to help with plagiocephaly? Well, today, parents are exploring other options. They don't want to put their kiddo in a helmet. And so we are just grateful that you're looking for other options. It should really never require surgical intervention because most of these cases don't involve what's called craniosynostosis, where those cranial bones fuse prematurely. And that can cause just developmental issues, but most of the cases aren't like that. I'm going to go ahead and screen share. I'm going to show you a scan of a kiddo with some torticollis so we can kind of look through that and talk through that. So let me pull that up. Give me just a second. We're going to flip over to the screen here. Okay, so this is one of our scans. So this is a pretty cool just visualization of what's going on. So what we can see is, look at her C1. Look at this red. So red is significant, blue is moderate, green is mild. So we have a lot of red in this upper cervical. Can you tell which side she's got the torticollis on? It's obviously this right side. There's a ton of green all the way throughout her lower cervicals, her thoracic. So she does have some mild stuff going on here, which can affect just developmental stuff, sitting, crawling. But what we really worry about is this C1. This tells us that, yes, we've got a ton of issues going on this right side in her upper cervicals. And this is what we need to focus on when we are actually adjusting her. So those are pretty cool if you haven't seen one of those before. So, okay. So with the chiropractic adjustments, we encourage ways to support your baby at home. So we want to make sure that we are allowing for plenty of tummy time in multiple position changes. We've got to limit their time in things, what we call bucket babies. So babies spending hours in bouncers, swings, and car seats. Don't let your baby sleep in the car seat. Don't let them sleep where there's constant pressure. They're just always in something. There's something always pressing against their head. We really encourage you to get them on the floor, have them do tummy time, multiple positions. Free movement is huge with these babies. And alternating the sides that you're holding your baby when you're feeding or carrying them can also help. We have a whole guide in our office that we give you as a parent that's going to help with different positions and ideas and things for the torticollis, along with stretches that you can do on your baby at home. And then in the office, we will do some of our own stretches, plus we will adjust that upper cervical spine very gently on the baby. So, as I mentioned before, so many parents have this going on and they're basically just kind of left to say, well, maybe it'll go away. If you have questions, we're happy to answer them. Our DMs are open. You can comment below. You can give our office a call. We would love to take a look at your baby and just, see if there's some symptoms going on and give them a scan and go from there. So if you guys have any questions, don't hesitate to reach out. We're here for you.